Hello again. This is chapter 26 review. This is a hefty chapter all about Mycobacterium, especially Mycobacterium tuberculosis and other non-tuberculosis Mycobacterium. So let's get started. There's a lot of information in your PowerPoint, so I'm just going to touch on the most important aspects of everything in here to try and abbreviate it because it is lengthy. And there's a lot of information that is just not necessary for you to know or commit to long-term memory, because a lot of it is just it's just specifics. But I want you to understand and learn the main ideas about all these different groups. Okay, so let's talk about some general characteristics of these species. Mycobacterium are small branching bacilli. They're possibly slightly curved or beaded. They are strict aerobes. They're non-motile, non-spore forming. They have a high lipid content, or something called mycolic acid, in their cell walls. So they do not take up gram stain. Some resist decolorization with 95% alcohol. All of them resist decolorization with up to 3% hydrochloric acid. And for this, they are called acid-fast bacteria, AFB. Most of them require complex media for growth, and they can take anywhere from 2 to 3 weeks to grow, with an average range of 2 days to 6 weeks. So there's a wide range of growth times for these different organisms, but some can grow quick, rapid growers. Some grow very slow. It takes weeks to see them. Very important note. When it comes to Mycobacterium, the biologic safety cabinet is the single most important piece of equipment in the mycobacteriology lab. Remember that. Your biological safety hood is so important when it comes to dealing with these organisms. Laboratory workers that work in mycobacteriology labs are 3 times more likely to be exposed to tuberculosis than other lab personnel. And this is one of the primary purposes that we get a PPD test, or a purified protein derivative, PPD, that can determine if we've had exposure to this organism. So most all healthcare personnel have to have a PPD test upon hiring, and some facilities even require it every so often. Let's see. To collect Mycobacteria species, let's talk about what types of species are collected for culture dealing with Mycobacteria. A lot of the most common is sputum, respiratory species, or respiratory specimens. Those are the most common submitted for AFB testing. Blood and bone marrow can be another source. Tissue and other body fluids, another source. Urine, if it's first morning. And stool can be useful when dealing with HIV patients, because an organism called Mycobacterium avium is shed in the stool. So once we obtain a specimen, we have to prepare it. So proper preparation of these includes liquefying the specimen and then killing any non-mycobacterial organisms. So there's 2 steps to preparing these specimens for culture. We call that digestion and decontamination. So we liquefy and then kill any other organisms we might not want to grow. So when doing or performing the digestion decontamination, we use a few different agents. One is sodium hydroxide, and this serves as both a digestant and decontaminant. It breaks down the mucus. There's another one called N-acetyl L-cysteine, or NALC for short, NALC, is mucolytic, so it destroys the mucus. So it's a mucolytic agent. Another one called oxalic acid, and this is used with specimens containing Pseudomonas aeruginosa, so that will take care of that organism that might be contaminating. However, we cannot get rid of all or every contaminating bacteria, so you have to take that into consideration. So then we also centrifuge to concentrate organisms, and we achieve this by using a centrifugal speed force that is at least or greater than 3,000 RPMs to effectively concentrate the specimen. AFB has a very low specific gravity, so if you use a low centrifugal force, it actually has a buoyant rather than sedimenting effect. But we want our organisms to sediment at the bottom, so we use a higher revolution per minute, and that's greater than or equal to 3,000. There are a few other ways to lyse and centrifuge, and there's a few systems that are mentioned in your PowerPoints. Maybe read over those so you're kind of familiar with them, like the isolator lysis centrifugation system. That's one in particular. So once we've properly prepared our specimen and it's ready for culture, we perform a gram stain, of course, because that's our preliminary finding. And what you will see is either a faintly stained organism, excuse me, or you won't see anything at all because of that mycolic acid, and it doesn't allow the uptake of stains. If you do see a faintly colored organism, it would probably appear branching or curved and appear maybe gram-negative. May even be beaded or refractile. So, in a situation like this where Mycobacterium might be suspected, or a physician is particularly looking for a AFB organism, we would set it up with a couple of fluorescent staining methods. First, to screen for an AFB organism, and then if our screening stain methods are positive, we would do a confirmation staining method. So just brief review, because I know we've already learned these early on in the semester in the chapters. But our primary screening stains are auramine and rhodamine, and those are fluorescent stains. And then if those are positive, we would perform a confirmatory stain like Ziehl-Neelsen or a Kinyon. And if you recall, these are true acid-fast stains. Ziehl-Neelsen involves heat, and Kinyon involves detergent. And brief review, our primary stain is carbofuchsin, and then we would use a alcohol acid decolorizer, and then a secondary stain, which could either be methylene blue or brilliant green. And with either of these, our positive stains, positive AFB, would show bright red rods against a blue-green background. So just remember and recall that. So interpreting these smears after examination, sensitivity of these acid-fast smears varies from 20 to 80%. Just depends on the extent of infection. You have to observe at greater than or equal to 300 fields. And always keep in mind, so something to consider, some organisms will stain partially acid-fast even though they're not a true acid-fast organism. So you always have to keep that in mind. So let's talk about culturing these and isolating them. So they are strictly aerobic, slow growers, most of them, and some require increased CO2. So most pathogenic mycobacteria take anywhere from 2 to 6 weeks to grow on complex media. However, Mycobacterium leprae fails to grow in vitro, period. There are 3 general types of media used. We have egg-based agars, serum or agar-based media, and liquid media. So I'm going to talk briefly about each one of those. An egg-based media contains malachite green to suppress growth of gram-negative bacteria. Its ingredients are fresh whole eggs, potato flour, and glycerol. The most common egg-based media that we use is called Loewenstein-Jensen medium, or LJ medium. And there's actually something out there called Mycobacticil, and this is an LJ medium plus antibiotics, cyclohexamide and lincomycin, and nalidixic acid. So the Mycobacticil is the LJ plus some antibiotics. We have agar-based media. Most used are Middlebrook 7H10 and 7H11 agars. Let's see. Very effective agar. About 99% of positive cultures are detected in 3 to 4 weeks with this. And then the other agar type was the liquid media. Mycobacterium species grow more rapidly in liquid media. So there are some primary media. Middlebrook 7H12 and 7H13 are the most sensitive and rapid. See, there are some other culture media for the recovery of mycobacteria. Some can grow on chocolate agar. Mycobacterium haemophilum and marinum can grow on chocolate agar from skin and other body surface sites. So we incubate these at 30 degrees. Let's talk about identification a little bit more. The first step to confirm, the first step in identifying mycobacteria is to confirm that growth is composed of acid-fast organisms, right? Positive bottles must be subcultured to slants. Growth on slants is evaluated to aid the identification. Colony morphology. They're usually smooth, creamy, or rough. Just depends. Rough colonies of Mycobacterium tuberculosis can exhibit a texture called cording. So that's just a unique note there. Mycobacterium avium colonies are variable. Some are buff and creamy, while others can be small and translucent. And of course, the growth rate we've already discussed. It's a wide range, anywhere from 3 to 60 days. Rapid growers produce colonies in less than 7. So when I mention rapid growers for some of these specific organisms I'm going to talk about, those are organisms that grow in less than 7 days. The rest take longer than that. Temperature to grow these organisms. Most mycobacteria can grow in a wide variety of temperature, a wide range from 22 to 40 degrees. Some organisms will grow at one temperature specific to them versus, the other temperatures, but most will grow in that wide range. For instance, Mycobacterium xenopi, that one grows particularly best at 42 degrees. So there's something else, another characteristic of Mycobacterium that makes them unique, and that's a property of photoreactivity. So there are three classes of photoreactivity when talking about these. There are, the first class is called a photochromogen. This is where an organism produces carotene pigment upon exposure to UV light. The second class is a scotochromogen, and these species produce pigment in the light or the dark, so it produces it regardless. And then there's the non-chromogens. These are not photoreactive. They are usually a buff pale yellow color growth. Another classification way, another way we classify Mycobacteria is based on this Runyon groups, and this involves their photoreactivity. So there's Runyon group 1 through 4. Runyon group 1 are your photochromogens, and the two organisms that I'll briefly discuss that are in Runyon group 1 are Mycobacterium kansasii and Mycobacterium marinum. And there's Runyon group 2, which are your scotochromogens, and this includes Mycobacterium gordoni. And then your third class is Runyon group 3, or third group. These are your non-chromogens, and this includes Mycobacterium tuberculosis and Mycobacterium avium complex. And I'll discuss that complex part to that name here in a few minutes. And then your last Runyon group is group 4, and these are your rapid growers. This is Mycobacterium fortuitum and the Chelone complex. So there are several other tests to differentiate between Mycobacteria species and isolates, and there are quite a few different tests important for the mycobacteriologist. I'm just going to briefly mention some of them and a couple of details about each one. So there's the niacin accumulation test. 95% of Mycobacterium tuberculosis isolates produce free niacin, which is also known as nicotinic acid. Know this. There's the nitrate reduction test. This particular test can differentiate Mycobacterium tuberculosis from scotochromogens and something called the Mycobacterium avium complex. So nitrate reduction test helps differentiate. There's the heat stable catalase test. All mycobacteria are catalase positive, but not all strains produce a positive reaction after heated to 68 degrees for 20 minutes. So most Mycobacterium tuberculosis isolates do not produce heat-stable catalase. Some isoniazid-resistant strains do. Not all, but some do. Let's see, there's a semi-quantitative catalase test. This is where the column size is recorded as greater than or equal to or greater than or less than 45 millimeters. It's a quick 5-minute reaction test. There's the iron uptake test. Rusty brown colonies will appear in a positive reaction after the addition of 20% ferric ammonium citrate. This particular test is useful for distinguishing M. chelone, which is negative, from other rapid growers, which are positive. There is the pyrazine amidase test, or PYZ, and this distinguishes Mycobacterium marinum, which is positive, from Mycobacterium kansii, which is negative. It also distinguishes M. bovis, which is negative, from M. tuberculosis, which is positive. There's the tellurite reaction. The tellurite positive are the Mycobacterium avium complex, and this will distinguish it from all other non-chromogen or chromogenic species. All rapid growers are able to reduce tellurite in 3 days. Just a note. There's the urease test. Positive is a pink-red color, and this can distinguish Mycobacterium Scopholaceum, which is positive, from Mycobacterium godoni, which is negative. And then there's just a couple other identification methods, and that includes chromatography methods that detects mycolic acids, and DNA hybridization, which detects specific rRNA that belongs to the mycobacteria. Okay, so that's just some of the tests. Just briefly be familiar with those. Let's talk about something called Mycobacterium tuberculosis complex. This includes 5 specific organisms. The first one is Mycobacterium tuberculosis. The next one is Mycobacterium bovis. The third is Mycobacterium africanum. The fourth is Mycobacterium candidii. And then the last, or fifth, is Mycobacterium microti. So let's talk about these. The first one being Mycobacterium tuberculosis. First described by Robert Koch in 1882. There are over 9 million cases of infection with this organism worldwide, and that was in a statistic from 2013. 80% of cases occur in just 22 countries. Africa had the highest number of new cases. TB, or tuberculosis, remains the leading killer of people infected with HIV. There are different forms of tuberculosis. The primary form of TB is a disease of the respiratory tract, acquired by exposure to droplet nuclei. A granuloma or a tubercle may form. In clinical diagnosis by positive PPD skin test and chest x-rays. They can be normal. And only about 25 to 30% of sputums from bronchial washings are positive at this stage. So primary tuberculosis can be hard to detect. Let's see, there's a reactivation stage. About 3.3% reactivate during the first year. That's talking about patients. There's several symptoms that go along with that, although many people still may remain asymptomatic in the reactivation stage. But symptoms can include night sweats, fever, shortness of breath, chills, hemoptysis, which is only in about 25% of patients. That's where you have blood in the sputum. And fatigue, anorexia, and weight loss are just some of those symptoms. Another form of tuberculosis is extrapulmonary, and this is more common in patients with AIDS. It's a miliary tuberculosis, where the seeding of TB can occur in many organs outside of the pulmonary tree with these AFB organisms. It can affect virtually any organ. Some other forms of extrapulmonary TB include pleural, lymphadenitis, GI or skeletal forms, which includes something called Pott's disease. of the spine, and meningitis even. So to identify this particular organism, Mycobacterium tuberculosis, it's a slow grower, about 2 to 3 weeks. You have this characteristic rough, buff appearance. It grows between 35 to 37. It's not photoreactive. It is niacin and nitrate positive. There is susceptibility testing with Mycobacterium tuberculosis isolates. Let's see. Usually these patients are treated with more than 3 drugs in a combo. Testing is meticulous and requires experienced personnel to determine susceptibility on Mycobacterium organisms. So common susceptibility testing includes drugs like ethambutol, isoniazid, pyrazinamide, rifampin, and streptomycin. So just some. So like I said, treatment usually involves 1 or more antibiotic. 3 is quite common, and it's usually a 9-month regimen of antibiotic treatment. There are some common reasons for drug failure, and that is patients are not compliant with their drug therapy, and there's quite a bunch of resistant strains. There are quite a few resistant strains. So sometimes resistance will develop and they'll have to change antibiotic treatment. There are these rising multi-drug resistant Mycobacterium tuberculosis isolates, and these are resistant to 1 drug about 15% of the time. And there's approximately 2% of Mycobacterium tuberculosis isolates are multi-drug resistant. There are some rare cases of extreme drug resistant M. tuberculosis, or XDR TB, but these are also on the rise. So that's Mycobacterium tuberculosis. Let's go on to a couple other species. Mycobacterium bovis. This one produces disease primarily in cattle. Disease in humans resembles that of Mycobacterium tuberculosis. However, this one is even slower growing, and it's different from M. tuberculosis by its niacin and nitrate test, and those are both negative for this species. M. tuberculosis was positive for both those. Remember that. So let's talk about some non-tuberculosis mycobacteria, or NTM. Most of these are found in the soil. They're opportunistic pathogens. Usually they present as chronic pulmonary disease resembling that of TB, and they are transmissible from person to person. There is one group that includes 2 species, and that's the Mycobacterium avium complex. They call it the MAC. This includes Mycobacterium avium and Mycobacterium intracellular. They're very similar, so similar that we do not speciate in the laboratory for diagnosis. We just call it the MAC complex. It's these organisms in the MAC are common in the environment, usually in coastal marshes and natural waters. There's a higher incidence of infections in patients with AIDS. It's a cavitary disease in most patients, and MAC is the most common non-tuberculosis mycobacterium causing TB or tuberculosis disease in the U.S. Mycobacterium avium complex infections are most common systemic bacterial infections in patients with AIDS. So I already said that it was a higher rate of infection with those, but this particular MAC complex causes systemic bacterial infection. There is a subspecies of Mycobacterium avium, and that's paratuberculosis. So Mycobacterium avium subspecies paratuberculosis is the causative agent of a disease called Jones disease or John disease, which is an intestinal infection in cattle, sheep, goats, and other ruminants. It's a very slow grower, 3 to 4 months to grow. And it is a suspected causative agent of Crohn's disease, a chronic inflammatory disease of the human intestine. So interesting. Let's talk about another organism, Mycobacterium kansasii. And this one of the 2 most common causes of non-tuberculosis Mycobacterium pulmonary disease in humans. It's usually in the Midwest, Southwest, and California, here in the U.S. It's a slow grower at 37 degrees. It is a photochromogen, producing a dark red carotene crystal with prolonged light exposure. This one's catalase positive. Another organism, Mycobacterium gordoni. This is commonly found in water taps and referred to as tap water bacillus. It's usually a contaminant. It is a scotochromogen, producing yellow-orange colonies, whether grown in the dark or light. It is nitrate negative. Let's see, another organism, Mycobacterium haemophilum. This is unique in that it requires hemoglobin or hemin for growth, and so this one can grow on chocolate agar. This is optimally grown at 28 to 32 degrees. Another organism, Mycobacterium marinum. This is implicated in diseases of fish isolated from aquariums. However, cutaneous infections in humans involve contact with salt water or inadequately chlorinated fresh water. Usually presents as a tender red or blue subcutaneous nodule called a swimming pool granuloma. So people that work with aquatic animals or at a pet store working with fish aquariums that may clean them out, they're higher risk for possibly contracting this. Mycobacterium marinum is a slow grower between 30 and 32 degrees. It is a photochromogen. When exposed to light, turns a deep yellow colored colony. Another organism, Mycobacterium cheloני. This is a rapid grower, rapid growing mycobacterium. Less than 7 days to grow, non-pigmented. Another organism, Mycobacterium fortuatum, and this is a group of organisms actually. So they call it the Mycobacterium fortuatum group. And this has been implicated in infections of the skin and soft tissues. Another organism, Mycobacterium flea. This one is common in hay and grass and is called the hay bacillus. Occasionally found in human clinical specimens. It's a rapid grower at 37 degrees. Colonies are usually rough, yellow to orange pigmented. And the last organism of discussion is Mycobacterium leprae. And this is also called Hansen's bacillus. and it is the causative agent of leprosy or Hansen's disease, and this is a condition involving skin, mucous membranes, and peripheral nerves. Diseases are rare here in the U.S. It's not considered highly contagious. There are two different forms. The first form is tuberculoid leprosy. This is skin lesions and nerve involvement. Usually it's a spontaneous recovery. And then there's a second form of leprosy, and this is lepromatous leprosy, and this is slowly progressive, malignant, and potentially life-threatening. You'll have skin lesions, nodules, and progressive nerve damage with that form. And to identify leprae, it does not grow on lab media, so diagnosis depends on demonstration of AFB in skin biopsies without subsequent culture growth. Confirmation can be made by producing disease in inoculated live mice. So leprosy is a very difficult one to actually confirm. So that's a whole bunch of information on Mycobacterium tuberculosis and other non-tuberculosis mycobacteria. It's kind of hard to organize these and keep them all straight. I recommend that you just zone in on a few very specific details for each of those organisms. Know what is included in the groups or the complexes. Make yourself a chart, but that's that. Have a good day.